It began in healthy-looking pigs, months, perhaps years ago. A new coronavirus spread silently within herds. Gradually, farmers started getting sick. Infected people got a respiratory illness with symptoms ranging from mild flu-like signs to severe pneumonia. The sickest required intensive care. Many died. At first, the spread was limited to those with close contacts, healthcare personnel, co-workers, and families. But now, it's spreading rapidly throughout local communities. International travel has turned local epidemics into a pandemic spanning the globe.
One of these days, one of these epidemic events will be a pandemic, a fast-moving pandemic. And mitigating risk and impact of that pandemic will require an all-hands-on-deck approach. And we know from past responses that public-private cooperation will be essential.
We're at the start of what's looking like it will be a severe pandemic. And there are problems emerging that can only be solved by global business and governments working together.
Experts agree unless it is quickly controlled, it could lead to a severe pandemic, an outbreak that circles the globe and affects people everywhere.
We could be looking at double the number of cases in 1 week and 16 times as many in a month if we are not able to stop the spread. That would be on the order of 500,000 cases, and it would continue to rise exponentially. In 3 months, we could be approaching 10 million cases.
We have known about CAPS-like viruses in animals and people for decades, but have not been successful at developing a licensed vaccine. And sure, there are new technologies that may help, but it's going to be difficult. I am not optimistic about having a vaccine in time to be relevant during this pandemic.
How should governments, business, and international organizations allocate and distribute pandemic antivirals and medical supplies to the people who need them most?
People are avoiding public spaces out of fear of infection and in compliance with public health recommendations. This has had a dramatic effect on the retail and service sectors. Businesses of all kinds are struggling to operate, let alone provide basic services as their workers have fallen sick or refuse to come to work.
How should national leaders, businesses, and international organizations balance the risk of worsening disease that would be caused by the continued movement of people around the world against the risks of profound economic consequence of travel and trade bans?
Common sense says it shouldn't be controversial to suggest our response should prioritize both lives and livelihoods. Absolutely, we need to save lives. We all know someone who's been affected by CAPS. But we literally cannot afford a heavy-handed response that suffocates our economy. Pragmatism is a wise choice.
Countries are reacting in different ways as to how best to manage the overwhelming amounts of and misinformation circulating over the internet. In some cases, limited internet shutdowns are being implemented to quell panic.
The outcome of the CAPS pandemic in Event 201 was catastrophic. 65 million people died in the first 18 months. The outbreak was small at first and initially seemed controllable, but then it started spreading in densely crowded and impoverished neighborhoods of megacities. From that point on, the spread of the disease was explosive. Within 6 months, cases were occurring in nearly every country. The global economy was in a free fall. The GDP down 11%. Stock markets around the world plummeted between 20 and 40% and headed into a downward cycle of fear and low expectation. Businesses were not borrowing, banks were not lending. Everyone was just hoping to hunker down and weather the storm. Economists say the economic turmoil caused by such a pandemic will last for years, perhaps a decade. The societal impacts, the loss of faith in government, the distrust of news, and the breakdown of social cohesion could last even longer. We have to ask, did this need to be so bad? Are there things we could have done in the 5 to 10 years leading up to the pandemic that would have lessened the catastrophic consequences? We believe the answer is yes. So, are we as a global community now finally ready to do the hard work needed to prepare for the next pandemic?